Abdo today.
Oh yeah, what name is it?
Sue Bathurst.
Alright, upstairs. Straight up the stairs to the left and take a seat.
Thank you very much. Okay. Women's health covers a multitude of symptoms and conditions, from the onset of periods to fibroids, endometriosis and fertility issues. And if that's not enough to deal with, you can always look forward to the menopause. Now, for some women, it's a smooth journey through these years, but for others, being a woman can bring monthly battles that are both physically and emotionally draining on both the woman herself and her partner. Now, if you're nodding your head in agreement, you're not alone. But the good news is that you no longer need to suffer in silence or wait months to be seen by a consultant. Today, I'm going to have a look at the private and state-of-the-art facilities at Greater Lancashire Hospital in the heart of the northwest of England. I'm meeting with Mr Khalil Abdo, a leading consultant in women's health, to find out what issues women are dealing with on a day-to-day basis and how quickly diagnosis can be made and treatment commenced. The hospital is just over a mile off junction 31A of the M6 and has the added luxury of ample free parking on the doorstep. Now, the building has more of a hotel than a hospital feel about it. The staff are extremely professional and respectful, and I already feel a sense of reassurance that would certainly help to reduce the stress and anxiety of finally making a decision to seek help. The waiting area has a really relaxing and calming feel about it, and considering how quickly you're able to get an appointment, once here you never feel rushed or unable to ask every question on your list. Good afternoon, Mr Abdo.
Hello Sue, how are you?
Very
Lovely
good.
to see you.
Thank you so much for taking the time
Please come
to
in,
speak
have a seat.
to me today.
You were more than welcome.
I have to say I've been looked after so well by everybody here.
I would hope so. That's
Yeah.
what you're here for.
It's been excellent. I've got some questions for you.
Yes,
Are
how
you
can I
ready?
help you?
Okay.
Go ahead.
Women's health, massive area. Okay. Why would somebody come to Greater Lancashire Hospital? What are the sort of conditions that you normally get to see women for?
Well, we have the service in two parts.
Okay.
One is general gynecological conditions,
Mm-hmm.
which encompasses many aspects like pelvic pain, menstrual problems,
Okay.
hormone replacement therapy type menopause issues,
Okay.
and then we have a service dedicated for fertility services,
Okay.
and there are two separate areas.
Okay, so let's talk first of all then about the general areas for ladies, because we'll talk about the fertility as a separate thing. Is there a certain age group of ladies that you know are appealing to this sort of service?
There are three groups of ladies.
Mm-hmm.
The young ones, the ladies with what we call reproductive age, in their 20s, 30s, early 40s.
Mm-hmm.
Then we have ladies who are reaching the menopause, we call them perimenopausal ladies.
Okay.
And we have ladies after the menopause, postmenopausal ladies. And certain groups will have different requirements and ailments. So
Okay.
each group will need careful assessment to reach a diagnosis. If you reach a diagnosis, of course, you can offer them effective advice and treatment.
Okay. So what's the difference coming here to Greater Lancashire Hospital compared to going to their normal GP?
Okay. Well, the UK system, most patients will go to their GPs,
Mm-hmm.
but the GPs are generalists.
Mm-hmm.
They can deal with many problems, and they tend to follow their own college advice and
Okay.
protocols. However, there are many patients who need specialist advice. The difference is here they will see the consultant. They will choose to see which consultant they want.
Mm-hmm.
They choose a consultant that they feel that it meets their requirement. The difference between this and going to an acute hospital, they do not have the choice.
Mm-hmm.
They will meet either the consultant, not necessarily of the choice, or member of the team. And it's this change in circumstances where they have to see different people along the way will lead to a longer time of reaching a diagnosis and treatment. So they won't get inferior care because we hope that all, as doctors, we do not we treat patients equally, but because of funding and because of structure in the system, it is going to take longer to reach a diagnosis and treat the patients for any problem if they go to an acute service than to come to...
And does that timescale cause further complications?
Well, in gynecology, you would hope that it will cause inconvenience rather than complication, because the NHS is a very good service for anything that is quite serious, like cancer, and we have 2-week pathways. And the genuinely GPs will push their patients to go through to the 2-week pathway because the system is set up for that type, and they get excellent service from that point of view. So we talk on outside cancer services here. It is, yes, it's better, not for complication, but for convenience. It's better for seeing a consultant, so they have the right diagnosis from day one. They might not even need treatment, so they're not wasting time coming backwards and forwards. They're not wasting tests, which is better for them and better for the health service in general, so money is not wasted along the way.
So when the ladies come and see you, would you say that they tend to be nervous or more fearful? Are they scared of maybe hearing a prognosis? Have they delayed things, maybe not wanting to know? Or are they looking for reassurance?
Patients are not all the same. There are patients who are looking for reassurance and they want to be seen privately by a consultant who they perceive is the right one for them, and they will accept their reassurances, which of course it's a treatment in its own right. But the patients will choose. They'll all be nervous, I must admit. Patients are nervous, everybody's nervous when they go and meet somebody new. But they're there to look for an answer and for an advice, not necessarily to have treatment. Treatment may follow, but they want the advice of the options, what they should do. And of course, our job as professional healthcare professionals, not to tell patients what to do. That will be easy. We'll tell them, this is your problem, that's what you can do about it, if any. And some patients choose to do nothing.
So your stereotypical patient that would come here, your lady comes in and she could have any one of these symptoms, any one of these conditions. What would happen in the general consultation?
Well,
what would you do?
Initially, we'll ask general questions. Might not be nothing to do with the condition, but it's important to establish a relationship with your patient. You have to know the woman. I speak about women because I only work with women usually. You know, to know how old she is, although it might be written in the notes, but it's important to see it for herself, how old she thinks she is, of course. The family, marital status, partnership. Remember, we see patients, doesn't necessarily to be man and wife, could be partner, could be single patient, could be same-sex relationship. So we have a diverse community here. We have to build a whole picture about the patient, and then we can move forward. So I'd like to see the patient as somebody who I know now how old and what she does and how many kids she has and what their name, any problems in the past, and then we start talking the problem, because you can then build up on that old history. So we have to tailor. So that's again why patients choose to come into an independent provider and see a consultant, because the consultant has been there for many years and tend to know which examination is important, which examination can wait, or which examination can be avoided.
So they can expect to have an examination when they came on the day?
In general, usually, for most gynecological problems, you would expect to have an examination.
So how long would a consultation last in general?
Again, that varies, and of course it depends on where you practice. Like GP practices, the GP might only have anything between 7 and 10 minutes at best to see a patient. Again, if you're a consultant or a team in an acute service, the consultations might only be built for 10 minutes or 15 minutes. In a place like Greater Lancashire Hospital, there's no time limit. So technically, an average new patient might last a minimum of half an hour. Some ladies might take an hour, 45 minutes. I had patients who took nearly 2 hours in private.
So one of the benefits here, the appointment system works where they get the time that's required to get for you to get all the information rather than having to then come back because you need...
So the system here is for you to come in and we listen, we do all what's necessary to reach a provisional diagnosis.
And how much information can you give them on the day of the consultation regarding further treatment, or do you have to wait for information to come back?
We can give them provisional information
Okay.
because many problems in gynecology tend to be straightforward,
Mm-hmm.
and we can say to the patient, you don't need anything,
Mm-hmm.
this consultation is enough,
Okay.
or they've had a diagnosis made somewhere else and have the results of tests with them,
Mm-hmm.
and we are just interpreting to them in a language that's suitable for everybody to understand what the problem is.
Mm-hmm.
And that's another problem. Sometimes patients given diagnoses in other hospitals or by GPs
Mm-hmm.
that will turn up, say, I have this condition, but it's never been discussed. So they're frightened.
Mm.
They've given information, some certain names, but they say, oh, well, you have polycystic ovarian syndrome, and that's it. And the patient goes home and thinks she has cysts in her ovaries.
Mm-hmm.
Of course, everybody gets worried. Why do you have cysts? Not knowing this is just a diagnosis by scan, and polycystic ovarian syndrome is generally a hormone condition.
Okay.
Nothing to do with cyst that needs surgery.
Okay. So they've had the consultation, and I would imagine, of speaking to you today, obviously they would feel very at ease. You're a very easy person to talk to. What happens next?
Okay, well, then they have the consultation. If we had reached a diagnosis,
Mm-hmm.
well, then plan is options of management,
Mm-hmm.
and options will range from doing nothing. The
Okay.
patient might say, thank you very much, I know all about it now, I'm happy. Or they might choose to have treatment, and of course the treatment depends on the problem. The choice they make depends on the information we give them, the problem they have already and how bad it is. So there are many factors, and depend on all of these factors, the patient makes a choice. Once the choice is made, now the choice can be made on the day, patients might want to think about it. They get information leaflets to support the consultation. They will go through it and come back at a later stage if they wish to undergo treatment.
Okay, so what would you say then is the main advantage of coming to somewhere like Greater Lancashire Hospital for them? If they're watching this now and they're looking, saying, that's me, I have those symptoms and I've had these symptoms for a considerable amount of time now, why would they ring here and come here?
Well, the advantage is they're going to see the consultant
Okay, straight off.
straight off.
Okay.
They're going to have a reasonable consultation to reach a diagnosis
Okay.
or a differential diagnosis, and they're going to have a plan of management, all done at the same consultation.
And how quick could that happen? How quick could they get an appointment with you?
Well, appointments can be done alternate weeks
Mm-hmm.
as standard, but if the patient needs sooner time, the secretaries will go out of the way to organize a sooner appointment out of normal clinic sinks.
Okay.
So the patient will always have choices of different times that suits them.
Okay. So following then the consultation, they will receive, do you send them some sort of report or some notes, and then that gives them the options. They can come back here for treatment, or they could then take this information back to their GP.
Well, if it's for surgical procedure,
Mhm.
we'll give them the information before they leave,
Oh,
so they
okay.
can think about it. Okay. The patient will never be in the dark.
Yeah.
They always know what's going to happen next, and more importantly, they always have access to our support staff.
Mm-hmm.
If there's sometimes people forget to ask something, we have email support. If they want to ask questions by email, and I'm usually more than happy, and I do this all the time, answer our patients or their relatives, as long as they have the consent from the patient, to even if they send an email. I could be away,
Okay.
I respond by email. Okay, so there's always, that's the advantage. If you're seen in an acute service, there's no way that you're going to get an email support from a consultant, not because the consultant doesn't want to, but the volume of patient will prohibit this practice. And of course you wouldn't remember, because you might have seen 200 patients in that hospital that month. You wouldn't remember, and you have to look for notes. In the private sector, it's a bit easier. We have access to notes quickly, so we're not really searching through archives of notes. We have them usually online.
Okay. So you can be seen quickly, you can get straight to a consultant, you can get relatively, a diagnosis relatively quickly, and therefore treatment, which I think is imperative, can start much sooner, can't it? This route will take you.
So it's the journey.
It's
So
the
at the end
journey.
of the day, it's two part of it, of the of what we do
Mhm.
here, is giving you a satisfactory consultation.
Yes.
So you are happy with what you hear, the advice that you really need to know from a consultant, and we give you a shorter journey to get an answer.
Mm-hmm.
Now the answer differs for different people. Sometimes the answer is to do nothing. Sometimes the answer is, although you don't want to hear it, but you're happy to know that there's an answer then you can build on that answer. And that's more typical with fertility, for example.
Yeah.
Or there's an answer that there's something can be done, and you can move forward. And of course, the main advantage is you have the time to tell the story.
Which I think is absolutely vital, isn't it?
That's right. So 10 minutes in any practice is not enough. And we always have an old saying in medicine, if you give a patient long enough time, they will tell you the diagnosis themselves. Because they live with it, and all the clues that they're going to give you, eventually they will know themselves what's wrong with it.
They will know.
Yeah.
That's excellent. Thank you very much for your time today.
Thank you very much.
It's been really fascinating, and it's lovely to meet you and talk to you.
Thank you very much.
And,
It's a pleasure to talk to you.
Yeah, and I will see you again soon. Thank you.
Very much. Take care.
Seeking medical advice on women's health is a tremendously intimate and personal subject, and Greater Lancashire Hospital have the perfect balance between being big enough to attract some of the best consultants in the country, yet small enough to offer a very personal service. Patient appointments are not rushed, with patient care at the heart of everything that they do. The highly qualified and professional staff deliver everything that you would want and expect from private healthcare. You can be seen by one of the UK's leading consultants within a week in order to get honest, clear and accurate answers to all of your questions. And whatever your diagnosis or treatment plan is, you will certainly leave with reassurance and peace of mind. So whatever your women's health needs are, call Greater Lancashire Hospital today and take the first step in ensuring that you have the best quality of life.